is where the type of diagnostics that Dr. Sharath and his team are able to do are even more, that much more so important.
Right. Okay. Yeah. So you can actually get the patient's history, even if it's not available to you. This can help you with the history. Yeah.
Definitely.
Okay. Yeah.
So we
So
have
that's
some
good.
instances where the patient come in comatose state or not, they're not in full conscious. So it's very tough to get the extract the histories, and sometimes images will speaks for them. So
Right.
we'll come to know what exactly is happening inside the patient's body, and definitely it will help with particular patients like who are not conscious and who are not able to tell their own stories.
Right. Right. Well, welcome to the show this afternoon. If you've just tuned in, this is your Straight Talk Drive to 5 show, and it's Medical Monday, and I'm in the studio with Health City. I'm joined by Dr. Sharith Babu. That's who you just heard. He's a consultant radiologist and head of the Department of Radio Diagnosis, yeah,
Yeah.
and Nuclear Medicine, as well as Dr. Neeraj Shetty, who's a consultant vascular and interventional radiologist, and Mr. Shamari Scott, who's the Chief Business Officer. So I'm very excited that Shamari is here with us this afternoon because he's not been here in quite some time. And when he's here, he makes my job so much easier because he can facilitate all the conversation. Today is November the 8th, and so it's World Radiography Day or International Day of Radiology. And so that's what we're here talking about, and it's really exciting. I have not had so much excitement in the doctors yet. Like literally, this is your excitement curve.
Mm-hmm.
I know Dr. Neeraj is new, right? But this guy comes in with the party, so good stuff. I mean, I'm quite excited about that. So talk to us a little bit, Dr. Neeraj. Bring us up to speed with what you do and some of the stuff that we want to learn today.
Okay. Hi. Good afternoon,
Hello.
everyone.
Hi there.
Good afternoon, everyone. So, intervention radiology, what it does is it uses the power of imaging to treat. So, a traditionally large surgical incision can be avoided most of the times. Talking of a bit of history, so in the late 20th century, as late when X-ray was discovered by Röntgen, a scientist injected a dye in his own arteries, and the field of angiography was born. And within a few decades, we could see the arteries in the leg, we could see the arteries in the upper limb, the chest, the abdomen, the brain, and it was so amazing. And it just happened, the technique was just a small needle into your artery and injecting a dye or a contrast material. So that's how intervention radiology started. So in 1963, a bit of history. So Sir Dr. Charles Daughter proposed the idea of intervention radiology. So by mistakenly during a operation, he came across a procedure, and there was an procedure called angioplasty. So there was a block in the artery, and he went inside, and he used a balloon to open up that block in the artery, and from there, angioplasty was invented, and
That's right.
and there was no stopping to it later. Then the cardiology started. All our cardiology procedures, most of them, whenever there's a blockage in the heart, so through a uh, uh, minimally invasive technique, we could access the artery, go inside the heart, and open up the blockage using a small balloon. And from there, it just took pace. The intervention under a minimally invasive procedure, not only vascular intervention, non-vascular interventions also picked pace because everything could be done in front of your eyes. Nothing had to be opened up, and so the mortality of a patient came down drastically. Whenever a small procedure had to be done, it was done intravascularly, so no one had to be cut open or something. So it's a boon. Because of Rongen, it started with the diagnostic thing, and it got accelerated to such a thing where we could treat now with a minimal invasive technique like this.
Okay.
Yeah.
All right. So how is it that you work together then with the person who's going to perform the procedures? Because obviously, we go through these tests, right? Like even the executive health check, we go through the test, and then someone has to read it. So this is what you all are doing, right? And then Now, how is it working? Like you're saying, Shamari, it's kind of a team effort thing, right? In terms of treating a patient. How is it kind of connected then?
But the interesting thing is with Dr. Miraj is that traditionally, a Dr. Sharif and his team would read and would also have the actual imagery for a physician to open you up to go in to actually do a surgery. The unique thing about Dr. Miraj is that he's actually able to do procedures,
Okay.
right, from his seat where he's at,
Okay.
which is minimally invasive and also reduces the actual risk of if he wasn't here and another physician had to go in and do a more complex type of scenario where they're opening the body, then the risk increases. So what's
Okay.
unique about Dr. Niraj is that certain types of procedures he's actually able to do himself
Okay.
with
Okay.
interventional radiology.
Right.
So I can give an example. Like
Yes.
as you told, the patient comes for an executive health checkup.
Right.
So if a guy comes and the old little elderly man, so he has an enlarged prostate. The
Right.
prostate has enlarged. Or there's a female who comes with a fibroid, a large fibroid in the uterus, which is
Right.
the most common thing seen.
Right.
So traditionally, what we have to do is to read the images, diagnose if the patient has a prostate enlarged or a uterine fibroid, which is quite big, and we used to send it back to the physician. But traditionally, the surgeon used to operate that depending upon the size and other things, and they had to cut open, take it out, and other things.
Right.
But when it comes to interventional radiology, the Neeraj will explain in detail. So he comes in between that step, and he's the one who takes care after that. So he can explain how
Okay.
he does for fibroids and prostate as well.
All right. Which has really kind of changed the scene of what used to happen, right?
Exactly.
Okay.
Yes.
So talk to us a little bit about that.
So let's talk about uterine artery embolization. So it's the main clinical indication for uterine artery embolization. So basically, uterine is for uterus, as you know, which organ is a, and the artery is a blood supplying the uterus, and embolization means blocking that artery.
Okay.
Okay. So why we do it? So basically, patients who present with a large fibroid. So normally the clinical presentation will be they will be presenting with increased bleeding during the periods. So more than 7 days of period, that is called as menorrhagia, uh, uh, or more than 7 pads per day. So that means the patient is bleeding a lot. So we do a multidisciplinary team now. So it involves an intervention radiologist and a gynecologist, and we come to a conclusion what has to be done to the patient. First, the diagnosis. That is through imaging we come to know it's a uterine fibroid. Then, depending upon the age of the patient and depending upon whether she wants to bear child, whether she has finished bearing the child. So these are all the clinical indications I'm just telling.
Right.
So
Right.
depending upon all that planning, so it's a multidisciplinary team. You need a gynecologist and an intervention radiologist.
Right.
So then we come to a conclusion that okay, fine, we have to do a uterine artery embolization now. So what we do is we make two small holes in the arteries in the groin or in the arteries in the arm. We pass a catheter, a wire, and we go inside specifically in those arteries which supplying the uterus, and we inject some blocking agents, otherwise called as the embolizing agents. So
Okay.
what it does is, so we are blocking this artery, and over the time, that tumor shrinks or the
Okay.
uterus shrinks. So there's this all this complications of bleeding, a large fibroid compressing on the bladder, which causes a lot of pressure changes, causes a lot of urinary incontinence or all those urinary symptoms. So all this can be avoided, and all this is through minimally invasive thing.
Right.
Yeah,
Okay. So instead of like a major surgery, then
exactly.
yeah. Okay.
So
So you're
we are
able
we are
to.
doing this.
Okay.
And that is one example.
Yeah. That's a good example. Just to have us understand really the difference and kind of how technology has really increased and has improved what you're able to provide, right? Yeah. And so that would mean that when you were studying, did you study like a multidisciplinary
So
thing or yeah?
everything is multidisciplinary.
Okay.
So when it comes to patient care, depending upon the speciality of the, for example, uterus. So We have Dr. Pooja Montero with us, so she is the gynecologist with us. So
Right.
everything is it's a teamwork to come to a conclusion.
Yeah.
Yeah.
Okay. All right. All right. So today is World Radiography Day. It's International Day of Radiology, and we are here. We're talking with Health City. Today's Medical Mondays is sponsored the Straight Talk Drive at 5 show, sponsored by Health City, and just bringing information. We have Dr. Sharath. He leads the diagnostic team, as well as Dr. Niraj, who recently joined in the area of interventional radiology, hence widening Health City's current scope of services. The team is sharing some technical aspects related to imaging, and through adherence to the image gently, what is that, radiation safety and pediatric imaging, and ALARA, as low as reasonably achievable. We'll talk about that, yeah. Standards, Health City strives to limit radiation exposure while producing high quality images that support accurate diagnosis. And that's very important as well, right? And you were talking about MRI, which really is basically very safe. Yeah. Yeah. And so also doing pediatric stuff as well, and just so you have a lot of things going on, a lot of great advancements, Shamari, out there at Health City, and bringing us closer to just being able to solve all of our problems here.
No, definitely. And as you know, we always have gifts for you, Catherine, and every month or every 2 months we bring you a new gift,
Okay.
right? So this is your new gift here.
Okay.
That if you ever need anything from an interventional radiology perspective, we have it at Health City. And I know you're very shortly going to go to a break, but then after the break, definitely want to speak to how Dr. Sharath's area as well as Dr. Niraj's area um, intersects with oncology, which everybody knows that cancer is a big issue that we like to discuss here within the Cayman Islands. And the fact that we're bringing everything close, the pandemic really showed us how important it was to have these higher level of services here. And we're just going to continue to fill those gaps that otherwise you would have to fly overseas. So we were telling people we're within your reach, and even when borders open, a lot of people would have experienced Health City that otherwise wouldn't have, even though we had a large portion of the local population coming. We've definitely proven ourselves, and we look forward to helping in all of these additional modalities moving forward.
Yeah, and definitely, I mean, you have a lot of the things that you're offering are not just in East End either, right?
Correct. So, once again, within your reach, we wanted to make sure that 70% of the population live in Georgetown and Westgate, that we're also having a clinic that's closer to where people live as well as work. During the day, over 90% of persons are actually in the town 7 Mile Beach corridor. And that's why even at the Camana Bay location, we're open from 7 a.m. until 7 p.m. Monday through Saturday. So I know my wife complains a lot that everything closes at 5 during the day. They act like people don't work.
It's
So
true.
we listen. So we're opening later till 7. We open earlier from 7 so persons can come in and see us before they go to work
Right.
at 9.
It's good.
And then on Sunday we're open from 12 to 4. So if you had all your shopping to do on Saturday,
Right.
and you didn't get to see us, you can come see us on Sunday as well. And that's also extended now. We have our own unit for the PCR testing, that those same hours, 7 to 7, as well as on Sundays, you can come and get your PCR test if you like, which is a separate office right next to our clinic door. So there are 2 offices right there that you can gain access to easily throughout the week as well.
Okay, all right. And so it's pretty simple then, and could just convenient for people to do that.
Definitely. And we also take walk-ins. So we know a lot of times things happen, and you wouldn't have been thinking about setting an appointment. We also take walk-ins that you can come, and we'll definitely let you know the timing to see you. Because if it's urgent, obviously we're going to see you right away. But if it's a little less urgent, you might have to have a little bit of a wait, because obviously people would have had appointments. But we're definitely working to see as many people as would like to see us.
Right. And I know you all have some diagnostic and therapeutic services like laboratory and specialized testing, advanced medical imaging and radiology, And you have, of course, your executive health checks, which involves all of that, right? Getting you checked out and making sure that you're okay. Lots of things going on at Health City. Thank you all so much for joining me this afternoon. We will take a quick break, but we will be back and continue the conversation with Dr. Sharath Babu, who's the consultant radiologist and head of the Department of Radio Diagnosis and Nuclear Medicine, as well as Dr. Neeraj Shetty, who is the consultant vascular and interventional radiologist. And we brought by Mr. Shamari Scott. He brought these gentlemen here, introducing Dr. Neeraj to the Cayman people. And how are you feeling? How are you feeling about Cayman? How are you making the adjustment?
Oh, it's a beautiful place.
It is. Yes, it is.
I got a house next to the beach. That's like a dream.
Yes.
I can go snorkeling every Sunday in that.
Wow. Look
And
at that.
I saw a stingray. I was scared to death.
Right?
That was my first stingray.
Yeah. And it wasn't at Stingray City, so yeah.
And the people are beautiful. And one thing I realized that you can connect with anyone if you have humor.
Right. Absolutely. It
It's
is
really
true.
fun.
Yeah, we're very laid back, very relaxed, and we take pride in that. That's our Cayman kind, as they call it, right? We're going to take a quick break, but we'll be back with more. So stay tuned. This is your Straight Talk Drive at 5 show. I'm Catherine Tyson, your host. We'll be back with more. Hold up. Wait. And welcome back to Straight Talk. This is your Drive at 5 show. Catherine Tyson, your host. Thank you so much for joining me this afternoon. It is Monday in the Straight Talk studio, and that means it's Medical Monday. And Medical Monday means that we talk to people from Health City because Medical Monday is brought to you by Health City. And today is November 8th. It is the World Radiography Day, or International Day of Radiology. So we are joined by the consultant radiologist and head of the Department of Radio Diagnosis and Nuclear Medicine, Dr. Sharath Babu, as well as the consultant vascular and interventional radiologist, Dr. Neeraj Shetty, and Mr. Shamari Scott. Chief Business Officer, who found a little time to come here with us today. We're very excited about that, Shamar. Where you been?
I've been working, man. I've been working, but I am sure Tiffany and Ben, filled in admirably.
They've been all
And
right.
I heard that you didn't want me back, so
Oh,
I
goodness.
stayed away as long as I
Stop it.
could, and then
Yeah,
I
no,
decided to show my face
it
today.
wasn't that. I said Shamar is avoiding me for some reason.
No,
You
I
know.
would never avoid you. Ever.
I know you wouldn't,
Ever.
But you're right. Tiffany definitely is a great, representative. She does her thing. She keeps me in line. She's very strict,
This is what we need to talk about now.
She's something
Catherine,
else.
come on.
That
Here we go.
Tiffany. Yes. She'll keep you, and she keeps the doctors in line and everything. And Ben, came out last week for the first time. So, definitely have a great team,
Yeah,
and
man.
you should be proud of that.
Definitely.
For sure. Health City on a whole is just a really great place. I'm always very excited about the things that you do there. Now, today is November 8th, and it is the World Radiography Day, International Day of Radiology. And so radiologists, radiographers, radiological technologists, and professionals from related fields all celebrate the 10th International Day of Radiology all over the world.
That's right.
That's what today is. So everybody is excited about today, not just my two doctors that are in the studio, right? Yeah? You were excited before. What's going on?
It's an important day for us, as we told, because it's not only radiologists, the supporting staff, particularly the technicians and the radiographers, the technicians. They play a very important role in this because all these images, the first point of contact will be the radiographers and the
Right.
technicians. They are the one who take all these images and finally we read them. So they play a very vital role, and most of them, their work is not recognized. But it's a day to honor them as well. That's why the World Radiographers Day is also mentioned on the same as World Radiology Day.
Yeah.
They play a vital role. It's maybe any department like nurses and other staff.
Right.
So radiographers do play a very important role because if they don't anticipate or if they don't see the patient's history or taking images properly, then we end up having images which may not be optimal to come to a diagnosis because once we do something called as contrast studies, there will be a chance of just 3-4 seconds where the contrast has to go through the body and the scan has to be taken.
Okay.
So if they just delayed by 3 or 4 seconds, the contrast would have just run through the major arteries, and what we want to diagnose may not be possible. So we need keen eyes, trained eyes, and experienced people to look after this. And definitely, our radiographers are doing an excellent job in getting the best images and trying to avoid the radiation as much as possible. Because if the scan is not done properly, it had to be repeated, and sometimes they give more radiation to the patients. So all these things can be cut down if we have a well-trained radiographers. So those are the people we should definitely appreciate their work for.
Yeah.
And most of the times they are working behind the scenes, and definitely it's a day to honor them as well.
Well, that was really great for you to say that. That was, very gracious to give recognition there. Today we're celebrating the International Day of Radiology and Radiography, just with the aim of building greater awareness of the value that radiology contributes to safe patient care and improving public understanding of the vital role radiologists and radiographers, as you just said, play in the healthcare continuum. So yeah, that's I think we take things for granted so much, right? We show up and something is wrong, and we just all right, this is wrong, fix that, and it gets fixed, and we go back to our lives, and we don't realize all of the little intricacies, and you know what I mean? Yeah, it's pretty important.
And at times as well, you may be going to places over and over and you can't figure out what's wrong. And previously it would be because you don't have the technology to really pinpoint what potentially would be wrong.
Right.
And the great thing about Dr. Sharif and Dr. Niraj is that their area with the toys, as I call them, or obviously with their tools, helps to give the greatest probability of figuring out what's wrong with you. And I think that's important as well. Before I hand it over to Dr. Niraj, I know Tiffany would kill me if I didn't mention what was discussed last week
Right.
Scan earlier, breathe easier,
Right.
which is our actual lung cancer screening that could save your life. So
Right.
it's low-dose CT scan and a follow-up consultation with our pulmonologist or lung health specialist, as laypersons would know them as, for only $50. And it's for people who are 50 years and older, have a heavy smoking history, and or is a current smoker or would have quit within the last 15 years. Because I guess smoking, even if you quit within 15 years, it's still there with you.
Right. Right.
And they can come in and actually we have a screening because not everybody can go for the actual CT, but we have a screening that we'll do, and if you do qualify, we'll go ahead and put you through, and then you get to speak to Dr. Archita as a follow-up consultation, just to see what's going on and if everything is okay, and if not, then what we would need to do moving forward to definitely help you to have a healthy as possible life from that standpoint forward.
Right. There
Yeah,
you
I
are.
just want to add
Yeah.
point to what Shumai told. This low dose CT is something which is different from the regular CT. As we told, image gently. The regular CT thorax would have something that's 5 to 6 millisieverts. That's the radiation dose what we get from a CT thorax. The low dose CT is something where the radiation is pretty less. It is just less than 1 or 2 millisieverts. So it's 10 times lesser radiation when compared to the regular CT, and still it can pick up lung cancer in a very early stage. So I
Okay.
just wanted to low dose CT is relatively safer than getting the actual CT thorax, so people can come forward and get the CT scan done without a risk of much of radiation.
Right, for sure. Yeah. So definitely, they can call Health 3640-4040, right? Or what's the email on there?
No.
No.
Come on.
I got the number.
What's the email?
info@healthcity.ky.
There we go. See, you got it. I'm on the website.
Stop challenging.
What's the website?
Stop challenging my brain.
You said two is enough.
Stop challenging
Two
my
is enough.
brain.
Two
Health
is
City.
enough.
Listen, I Google Health City, Cayman Islands, and I get the
All
website.
right, there we go. Okay. But it's
Yeah.
healthcity.ky as well.
For
So
sure.
you can go on. But definitely 640-4040 or info@healthcity.ky. And we've gotten quite a few inquiries since last week. So
Good.
definitely and it's a promotion that's only on for November. So take advantage of it,
Right.
and you won't get this low of a price anywhere else
Right.
to be able to come and do this type. Because at the end of the day, for us, it isn't about the actual making of the money. It's about persons coming in, gaining access, and figuring out if they have anything that they need to change or if there's any information.
Right.
Knowing is the majority of the battle, and we have enough physicians that will be able to definitely help you after you come and have the scan
Right.
if there is need for help.
So I have a question. Why do you have on a Health City mask and the doctors don't?
Because this is actually
This
a
is special
test
one.
mask. So this is, when you send for samples.
Okay.
So we have our samples.
So you got one?
So I got one sample to see if it works. So you see, they
Okay.
try it out on me
It's working.
to see if it works, to then say, all right, we'll order it or
We'll
not.
order a
Yes,
few
yes,
more.
yes.
So everybody should
So
have
they're
them
like,
soon.
can people hear you? Can you breathe?
I'm just wondering if you had the better one or the one that
No. This is the one that
standard
will,
one.
this is one that will be ordered if it works well.
Is it working?
So it's pretty good. It's pretty good. Can you hear me now?
I
That
can
was
hear
my
you.
only issue.
Last time we, like you were saying, the
Huh?
last time we saw each other, if we weren't wearing masks,
Exactly.
we've gone back to that now
Yes.
in so many ways,
Yes.
right? So it's quite interesting. So yeah, we wanted to talk a little bit more when we came back from break. We were mentioning some of the things that we want to talk about. So let's get back into the conversation so you can cover what you came to cover.
Definitely. So I had to mention our promotion because that has to do obviously with radiology as well.
And Tiffany will get you if you don't.
Tiffany is WhatsApping me, telling me that
Don't
I better
forget.
get on it and
Stop
say it
fooling
before.
around, Shamari.
So, all right, so I did my piece, so I can actually, go home in peace now.
Right.
But Dr. Niraj is very important to our future planning as well as Dr. Sharath. But as I said, Dr. Sharath is that old veteran that has been here since the inception. But Dr. Niraj was specifically also brought to be a part of the team based on what we're going to be doing from an oncology perspective.
Because they're going to give attention to the new
Yeah,
ones a little,
yeah.
to get
So-
them settled in. So,
So-
don't feel bad.
So I just want Dr. Niraj to be able to speak about some of the areas that he deals with that's unique, that also helps from a cancer care oncology perspective.
Right. Okay.
So I'll be talking about liver-directed therapies.
Right.
So a person comes normally as most of the liver cancers they are not detected because patients don't have any symptoms. They are incidentally detected while doing a health checkup ultrasound, and
That's one of the areas that are hard to really, know anything's going on, right?
exactly,
Yeah.
exactly.
Okay.
So once you know you have something in the liver, then a multidisciplinary team discussion happens, which includes a medical oncologist, a surgical oncologist, a radiotherapist, a radiologist, and an intervention radiologist. Then we come to a conclusion or come to a plan what has to be done to this tumor. So I'll be talking about a primary liver cancer called as hepatocellular carcinoma. So when it so after the staging is done and we know what has to be done to it. So initially, depending upon the size of the tumor, we either resect it or ablate it. So ablation is something which also has developed over the few recent years. So what is ablation? So liver directed therapy, number one, ablation. So what we do is we insert a needle inside the liver where the tumor is, and we just burn it off.
Okay.
So the benefits of it is again it's a minimally invasive thing which is done under vision, and normally it is done on daycare basis.
Okay.
So the complications are less, which means morbidity. So morbidity is less, and the patient is discharged by evening if everything goes well.
Right.
So that is one thing. So and the second thing, depending again, if the liver, if the tumor is slightly bigger, then we do something called as transarterial chemoembolization or
Right.
transarterial radioembolization as a bridge to surgery or transplant. So it is a standard of care. So what we do is, as I told earlier, we take a minimally access through the arteries in the hands or in the groins. We enter the liver, and we specifically go inside that artery which is supplying that tumor. What we do is block it by
Okay.
using embolizing agents, as I told you, using chemotherapy drugs and embolizing agent. We combine it together and we inject it inside the tumor.
Okay.
So 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 this is done as a bridge to transplant or to bridge to surgery, or sometimes it is when the liver is too involved and we can't do either transplant or surgery. So so what so when you do a hepatic, I mean liver is an important organ for your metabolism. So all the detoxification, all everything happens in the liver. Like
Right.
other
Right.
organs like heart, kidney, liver is very important too.
Right.
So decreasing the load on the tumor load in the liver, it increases the survival of the patient. So all these things are done, which can be done. So
All right.
yeah,
Now, what about, I see there's a couple of things here. So you talk a little bit about the uterine artery embolization for
exactly.
uterine
Yeah.
fibroids. You mentioned prostatic artery embolization
Embolization,
for benign prostatic.
hepatic hyperplasia.
You're right.
So
Okay. And that's kind of similar to the fibroid treatment as well.
exactly
Yeah.
similar to that, but it happens in males, as you know. Prostate is an organ.
Right.
Uh,
Yeah.
so benign prostatic hyperplasia is a disease of the age. Usually, the males, normally aged males, are affected by it. So prostate is an organ which sits right below the urinary bladder. So urinary bladder is an organ where the urine is stored from the kidneys. So when this benign prostatic hyperplasia happens, so it constricts the normal flow of urine, which goes outside. Like, so 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 there are a lot of it's kind of a debilitating thing because there is urinary retention. Patients are not able to pass urine properly.
Right.
It's the standard of life comes down,
Right.
affects the standard of life
Of course.
drastically.
Yeah.
So again,
And mentally as well, I guess, right?
exactly,
Emotionally.
exactly,
Yeah.
and it causes uh, uh, there is erectile dysfunction too,
Okay.
which can happen because of
Yeah.
that. So
Right.
all that factors are there. So the standard of care has always been medications and surgery. So and this is a new thing which can apply. We can apply
Right.
for it, or we can apply to it, and the results are also pretty good. And a lot of studies are coming out actually. telling how good is it compared in comparison with surgery, and less of complication rate. And again, a minimally invasive procedure which can be done in the morning, and hardly the patient has to stay overnight.
Okay.
This is discharged the same day.
All right. I mean, I just like that because it feels as if there might be some issues. Shamar, you know, we can appreciate this, right? There might be some issues that people are experiencing, but they don't want to come and ask about it, you know, or they don't want. But in this instance, it just feels like go ahead, get that checkup, find out what's happening because you could solve that problem very
Exactly,
simply.
exactly. And
Yeah.
again, you have to. It's a multidisciplinary team effort. A urologist is involved in this, along with the intervention
Right.
radiologist, along with the radiologist.
Right.
So everything is a team effort. So more minds are any day better than one.
Right.
So
Right. Now, what is? Go ahead. Go ahead.
which Catherine is another advantage of having Health City,
Right.
in that we have so many different departments that all work together,
Right.
that if you were to go to other places, at times you may only have one modality. But
Right.
by us having everything here integrated, we're able to take advantage of that full team that be best able to identify the issue as well as treat it right away.
Right. Right.
Where, previously you would have to go overseas for something, now you can get it done all under one roof here
Right.
in Health City
Right.
because of the level of services that we're offering and the way we work together
Right.
in order to make sure that we're solving it using all the best minds around the table.
Right.
So it's
Right.
like intervention radiology was the missing puzzle. So we are
Right.
complete now with intervention radiology so that we can do everything in-house. So if you take any cancer, so it can be treated in
Okay.
different aspects as well.
Okay. So Dr. Niraj was the missing piece of the puzzle. All the way in India, we had to bring him here, and right? Is that how that worked?
Yeah.
Okay, good. So you see, they're all excited about you, Dr. Niraj.
thank you.
So in a year, they're going to be like, yeah, that's Dr. Niraj. So you'll be doing your thing, right? But so what is the genicular? Is that genicular artery embolization for
Embolization.
early osteoarthritis? What is that?
So it's a new thing actually. It's coming up. So a lot of studies are coming up
Okay.
right now, and it's quite effective. So again, so basically osteoarthritis, as you know, it's genicular artery embolization is basically embolizing, as I told you before, blocking the arteries supplying the knee.
Right.
So normally patients who come with arthritis of the knee, normally who are not a candidate for total knee arthroplasty or total knee replacement,
Right.
not the severe kind.
Right.
I mean the mild to moderate kind of
Right.
patients who are not candidates for arthroplasty, but they are treated with a lot of painkillers over the time, exercise.
Okay.
So what are we doing over here? And the recent thing is the discovery. What we came to know is arthritis is an inflammatory process. So whenever there is increased vascularity, increased damage happens to the joint. So what we are doing, same, minimally invasive, taking an access to the artery of the hand or the groin. We are going inside the specific artery, and we are blocking those vessels. So what happens?
Okay.
Yeah. So decreasing the vascularity decreases the inflammatory process.
Okay.
In turn, decreases the pain.
Okay.
So it's a very good pain measure thing. So when we have to take a lot of painkillers, which is not good for your liver, not good for your kidneys, not good for your stomach. So it's a very good alternative for them.
Right, right. Sounds so for sure. And what about varicose veins? So what is some of the things that's also a part of
So
your
yeah,
yeah?
so that is actually I want to tell it is peripheral vascular disease. So basically concentrating on the legs. So peripheral vascular disease, either it can be arterial or it can be venous or it can be lymphatic. So arteries, they get the good blood from the heart, okay, and it supplies the nutrients, the oxygen, and the vein takes the bad blood back to the heart and the lung, basically the lung, and the cycle continues.
Right.
So peripheral vascular disease can be a disease of the artery or disease of the vein mainly. Okay, and third thing is lymphatic. I won't come to that.
Okay.
I'll just talk about arteries and veins.
Okay.
So artery, coming to the artery. So normally, again, this is a silent killer. Normally, patients with diabetes, hypertension, cardiac conditions. So normally, most of this patient will have this peripheral arterial disease. So how it is diagnosed? Normally, people ignore it. Normally, there's something called as claudication that limits the, because when this artery is involved, it doesn't, it's good blood doesn't reach the tissue. There is no oxygenation. There's no nutrition, and patients can't walk. So how you have to be alarmed that something is wrong with your limbs, and you need to see your cardiologist, or you need to see your intervention radiologist or a vascular surgeon. So everything, again, MDT, all three work together.
All right.
So something called as claudication. If you can't walk for you can't difficulty in walking upstairs, okay, you have sudden cramping pains in your calf, buttocks, okay, so you should be alarmed, because these won't present immediately. It's a very chronic process. It happens slowly. When all this is, there's something called, this is called as claudication. If something happens like that, and you have other comorbidities like diabetes, hypertension, cardiac conditions, so go to your doctor.
Right.
Okay.
Right.
So that is peripheral arterial vascular disease.
Okay. All right. So everything that I've been asking you. So Shamari sent a memo to me, and he said, ask these questions to see if he passes, because we want to know if he knows what he's talking about. I think you passed, and thank you so much.
I'm sorry. I just wanted to add one more thing.
Okay.
So if you're
It's
diagnosed,
extra credit.
Yeah, that's what it is.
Overachiever.
If it is diagnosed of a peripheral arterial disease, basically the below knee arteries, so again it can be treated with a very minimally invasive technique. As I was talking before of Charles' daughter, how he diagnosed how he was able to invent the balloon and open up a block. The
Right.
same way we can go inside the artery and just open it up, and the quality of life improves drastically.
Wow. Okay. Now, one more thing I want to ask you. So I'm seeing maintenance of arteriovenous
Fistulas.
fistulas and
Grafts.
grafts in chronic kidney disease patients.
Yeah.
Like, explain that to me.
So chronic kidney disease, patients, they require dialysis. The best way of doing it is uh, making a connection between your own artery and vein. So that what the surgeon does, and the dialysis takes place.
Okay.
So that is a chronic kidney disease is also quite a debilitating thing, but with the AV fistula or a AV graft in your own body, when they do a connection, you can do the dialysis through that. That is the most accepted way of doing dialysis,
Right. Okay.
and the most safest way. So what's my role in this? It requires maintenance because of the continuous dialysis, because the patient has to go for dialysis 2, 3, depending upon the depending upon his kidney function and all. So in a week he has to undergo dialysis twice a week, or 4 times a week.
Right.
So because of all this dialysis, it tends to get blocked. So I just open it up.
Yeah.
Yeah,
All
just
right.
I maintain it.
Okay.
So we can do it without any surgeries, and we can maintain it, and we can keep it working as long as possible.
Yeah. Sounds like you're going to be pretty busy. And it sounds like, we're in good hands, Shamari, bringing the one of the latest additions to the Health City team, the complement of the team, with Dr. Neeraj as well as Dr. Sharath, who work, I'm sure, very closely together, and with the radiographers. And, today being a great day to highlight them, because it is World Radiography Day and International Day of Radiology.
That's right.
Yeah,
That's
so-
right. So anything you need, definitely, as you know, Catherine, just give us a call, 640-4040, or email us at info@healthcity.ky. We have Scan Earlier, Breathe Easier lung cancer screening that could save your life. So if you're 50 years and older, have a heavy history of smoking, or a current smoker, or if you quit in the last 15 years, you may be a candidate. Your call will take you through a short screening test, and then we'll set you up to get that low dose CT scan, and then you'll get an appointment to see Dr. Archida, who is our pulmonologist, as well as she does many other things, but definitely for this scenario, she's our lung expert that you'll be able to see, and it's just $50 CL. You'll be able to come in and see her and get the CT scan as well. But
Right.
for Dr. Niraj, I want to say once again a huge welcome and thank you for coming and rounding out the team and joining us here for all of the things we're going to do in the future. And Dr. Shara, obviously for everything you've done in the past and everything you're going to be doing in the future as well. That helps
Absolutely.
Health City to be what it is,
Yes.
cutting edge and top notch.
Absolutely. And you are not the old shoe. Okay? You are a part of
That's right.
the whole team,
That's
right?
right.
And Dr. Niraj, congratulations on your first radio appearance.
Thank you so much.
Welcome to the Cayman Islands. Thank you so much for coming, for contributing so much. And I always say that the Health City team that contributes so much to our community and makes our life easier, because who knew this pandemic was going to take place, for sure. But the fact that it has, and the fact that we have such great technology and such great health care on island is amazing. It's within our reach.
That's right.
For sure. Thank you all so much for joining me this afternoon. Dr. Niraj, welcome again. Thank you for joining us.
Thank you.
Dr. Sharath, thank you so much for joining us as well. And Shamari, so excited that you're here today.
So if you're going to give me that welcome, I promise you that.
I don't believe you.
Well, if you're not going to give me the welcome, then I'm staying away.
We'll see.
We'll
'Cause,
see? Okay.
something will come up. You have a
Okay.
lot of stuff going on, for sure. And I understand. You're a busy man.
Okay.
Thank you all
Thank
so
you
much. And thank you, listeners, for joining us this afternoon. We're here for you, Medical Mondays. This is your Straight Talk Drive 5 show, brought to you by Health City. Have a great evening. If you're not there yet, well, happy travels. Take care of yourself. Monday's over. You just got 4 more days, and then it's the weekend. Take care.
Thank you.